When you're assessing if your pet is sick enough to come in at home, some things that might be helpful in determining that is looking at their vital signs. And when we assess an animal's vital signs, we look at their heart rate, we look at their respiratory rate, how well they're having blood perfusion through their body, meaning how well is blood getting out to their body, and are they dehydrated or anemic. Some common ways we can do that is if you look at heart rate on an animal, most people don't have a stethoscope at home, and rather than taking your pulse here for a person or here, instead for most dogs or cats, if you put your hand directly over their heart, in the middle of their sternum is where you're going to be able to feel it the greatest. In animals that are a little too well loved with too much padding, you may not be able to feel it there, so instead to the inside of their thigh, if you put 2 fingers and slowly with gentle pressure feel around there, you may start being able to feel their femoral pulse, which is the other place it's easiest to actually count a heart rate. For respiratory rate, standing back and watching their chest movement is typically the easiest way, and if you want to get an accurate count rather than counting for a 60-second period, start a clock for 6 seconds and count. Multiply that by 10. Most animals' heart rate shouldn't be above 200 beats per minute. Shouldn't be below about 60 beats per minute. So if they're falling outside of that range, especially if they're acting ill, there may be something that needs to be seen. Respiratory rate, you're also paying attention to their effort. So the respiratory rate on most animals, if they're calm, should be down less than 60 breaths per minute. If we're starting to have breaths that exceed that, or they're open mouth breathing when they shouldn't be because they haven't been working or exercising, there may be a problem with their ability to breathe. If they're coughing excessively, that may also manifest a problem related to heart disease, and you need to pay close attention to that. Perfusion issues, typically we assess those by lifting the lip of the animal if it's safe to do so, and looking at their gum color. Typically what you should be seeing is pink gums with a nice moist characteristic to them. If on the other hand what you're seeing looks pale, it looks very dried out. If it looks blue and an animal's having difficulty breathing, those are immediate reasons that you need to bring them in. So you can see how well they're getting blood flow to the different parts of their body by gently putting pressure on that gum and blanching it and pushing the blood out of the vessels there, and then watching how quickly it refills. Most well-hydrated animals with good cardiac output are going to have the refill occur within less than 2 seconds. If it is taking greater than 3 seconds to refill, that may indicate dehydration, poor cardiac output, or even anemia if their gums are pale.